Now we'll read about the recent advances in the composite resin. Advances in the direct composite resin materials includes the flowable composite resins, which are introduced by reducing the filler content, thus lowering the viscosity of the composite resins. They are developed to improve the handling characteristics of the existing composites. Having the fillers present in it are the silica, which have the filler content is about 60% by weight. They have the high fracture toughness due to their low modulus of elasticity. Hence, that is the reason they are employed in the low stress bearing areas where increased flow of the composite is desirable. Coming to the clinical considerations, due to their excellent flow, they are indicated in the pit and fissure sealants, preventive resin restorations, small class 3 and the class 5 restorations, has aligners in the class 1 and the class 2 cavities, and also for the repair of the ceramic crown margins. Now we'll see the packable or the condensable composites. They are special category of composite used in the posterior teeth due to their stiff consistency, which makes them packable or condensable like amalgam. The basis for the packable composite is a new concept called PRIM technology, that is polymer rigid inorganic matrix material. The fillers in the packable composites have a continuous network of elongated fibers of alumina and the silica, and after silination of these ceramic fibers, the spaces within the fibrous network are infiltrated with bis-GMA or UDMA resin, which promotes the good coupling between the resin and the ceramic fibers. That's how the polymerization shrinkage is reduced. When you see the properties of the packable composite are far superior to those of the conventional composite. That includes the greater depth of cure, low polymerization shrinkage when compared to other fibrous networks, and the lower wear rate and the radio opacity due to the presence of alumina. Now we'll see the Ormoser. The Ormoser is an organically modified ceramic consisting of the ceramic polysiloxane instead of the organic dimethacrylate monomers like bis-GMA. This material exhibits low shrinkage on polymerization and has high abrasion resistance. That is the reason it is more versatile in its application in both the anterior as well as the posterior regions of the mouth. Now we'll check the ion releasing composite resin. This novel composite resin has an alkaline glass fillers which releases fluoride, hydroxyl and the calcium ions based on the pH value immediately adjacent to the restorative material. So whenever the pH value lowers at the margins of the restoration due to the active plaque formation, the functional ions are released in the large numbers. Thus, there is a suppression of the bacterial growth and inhibition of the secondary caries around the margins of the composite restoration. Now we'll see the nano-filled composites. The nano-filled composites combine the properties of the hybrid composites of mechanical properties and the polishability of the microfilled composites. The filler distribution is about 97%, that is about the 75 nanometer clusters. They also exhibit significantly less polymerization shrinkage, about 1.5 to 2%. Now we'll see the compomers. They are developed to combine the durability of the composite resins and the fluoride releasing ability of the GIC. Hence the name compomers have been derived. If you see the composition of the compomers, the resin matrix has two distinct resins, that is urethane dimethacrylate and the tetracarboxylic acid with polymerizable hema side chains. They also contain the strontium fluorosilicate glass and also the photoinitiators and the stabilizers. The strength and the fracture toughness and the wear resistance are similar to those of the hybrid composite, and their color matching and the optical properties are very good and superior to those of the GIC cements. The compomers adhere to the tooth structure by micromechanical means and they require acid etching and application of bonding agent. Thereby, they releases the fluoride but to a lesser extent when compared to the GIC. They are indicated in the class 3 and the class 5 cavities as an alternative to the composite or the GIC. Now we'll see the Siloren composites. In this is a revolutionary new material. The Siloren forms the matrix instead of the bis-GMA or the UDMA. They polymerize through the photocationic ring opening reaction. This results in very minimal polymerization shrinkage of about 0.9%, which is lower than those of the composites. Now we'll see for the fiber reinforced composite. This consisted of the fibers of the glass or the polyethylene and the resin matrix being coupled during the manufacture of the composite resin. The end result is the fibers uniformly impregnated within the matrix. They have a very high compressive as well as the tensile strength and also the high flexural strength. That's the reason they are clinically used in the restoration of the endodontically treated teeth and the metal-free composite crowns and also for splinting. Now we'll see how the cavity preparation designs for the composite resins are there. First one is the conventional composite resin. If you see what is there in the conventional composite resin design, these are typical amalgam cavity preparation designs with an uniform depth, flat floors, butt joint, retention grooves in the dentil. This design is indicator for cavity preparations on the root surface and also for the large class 1 and the class 2 composite restorations. Next, we'll see the beveled conventional cavity preparations. This design is similar to conventional design, but some enamel margins have bevels incorporated in it. And it is mostly employed for the class 3, class 4 and class 5 composite restorations. Now we'll see the modified cavity preparations. These have a scooped out appearance without a definite internal line angles and are indicated for initial or small carious defects. Now we'll see the modified designs in it. That is the saucer-shaped cavity preparation. In this design, the outline form is like a scooped out appearance has that of the caries presence. The pulpal floor and the axial walls are only deepened till the caries is removed, and they are not of uniform depth. Finally, the facial and the lingual gingival walls are finished with a straight burst, giving the entire preparation a scooped out appearance. Now we'll see the box preparation. This design is used for the cavities only on the proximal side without the involvement of the occlusal aspect. If you observe this design, the axial depth should be up to the 0.2 mm inside the proximal DEJ. And there are no bevels or secondary retention features which are necessary for this. Now we'll see the slot preparation. This is similar to the slot cavity preparations done in the class 2 amalgam restorations, and it is indicated for the proximal carious lesions that can be directly approached from the facial or the lingual aspect rather than through the marginal ridge. The occlusal, facial, lingual and the gingival cavus surface margins in this design is about 90 degrees and the no bevels are indicated in this design. Now we'll go to the finishing and polishing of the composite resin restoration. The composite resins have to be finished and polished well to achieve the optimal aesthetics and the durability. If suppose there is an improper finishing and polishing, it is not acceptable due to the problems such as the surface staining, increased wear and the plaque accumulation which leads to the secondary caries. Now we'll see the concept of the rebonding. The rebonding refers to the application of a bonding agent on the finished surface and the margins of the composite resin restoration. After finishing and polishing of the composite resin, it introduces some micro cracks and removes the most highly polymerized surface area of the restoration. To seal these micro cracks, the rebonding is necessary. That is the brief about the composite resin restorations.